And a lot of those patients thus were either misdiagnosed or mistreated, which in some ways is even worse than misdiagnoses, because when you're sort of saying, yes, you have CRPS and you're nuts and, deal with it. Probably one of the worst things you could say to a patient, deal with it, suck it up. That's not your job as a physician. It's like going to a restaurant and then they're saying, hey, I'm hungry, I'd like to get fed. And the waiter says, well, deal with it. That's not how you treat a patient, right? So I think there's a epidemic of misdiagnoses and probably a bigger epidemic of mistreatment and misunderstanding of patients with CRPS. And it really goes back, again, down to the fundamental educational process that we have right now. We have a system in place that simply doesn't look at mechanisms of action with these complex pain diseases and really chronic pain in general back in medical school, back in residency. Now we're dealing with this opioid epidemic, right? But if you dialed into that, rarely will you actually hear the nuances of this epidemic. What you hear in the media is that if you have chronic pain and you're on opioids, you must be a drug addict, and that's simply not the case. When you look at the deaths that have come with opioids, people don't really delve into the details of where those deaths are coming from. They don't talk about the fact that the majority of those deaths are from counterfeit medications or from patients who have gone to illicits, or the fact that many of these people aren't even patients to begin with, or the fact that some of these patients have now gone to counterfeits or illicits because they weren't able to get the right care or diagnoses from the physicians that they entrusted their lives to, or these big hospital systems that they entrusted their lives to. So medical education is incredibly important. And again, when we do these kind of videos and when we do these types of educational programs, that's really the message we want to get across. Number one, thank you for even watching, because it means that you have an open mind. It means that you want to learn. It means that you want to make a difference and you want to help people and you want to do it the right way. So thank you for the people who are actually watching. Now, the people who aren't watching, well, whoever's watching, get those people to watch, get those people to learn, get them to actually look at the internet. Don't be scared of the internet. Now, I hear this also a lot. Physicians will tell patients, oh, don't look on the internet because you don't want to be exposed to bad information. That's absolutely true, but you also want to be exposed to good information. So I think it's our job as physicians and as healthcare providers to make sure that if we're going to tell the patients, to look at the internet, and quite frankly, they're going to look. Look, they're going to look whether you want them to or not. So maybe it's your duty to direct them to the right places and the right sources of information. Let them learn the correct facts. And you should too, right? Learn the correct facts, get the correct information from not just websites, but publications. Remember, publications can be skewed in one direction or the other, so it's our job to be able to read between the lines and to be able to filter good publications from bad publications. Publications that are wrought with bias or with inappropriate conclusions to publications that are accurate and describe mechanisms of action and have some type of insight into how a disease evolves. And when we do that, then we know what the facts are from what the fiction really is.